Good morning, students. I'm Dr. Indira, dealing the course Probiotics and Functional Foods. We are in Module 1, Unit 2. We'll see the next topic, that is probiotics and prebiotics in treatment of constipation. So, previous topic we have seen the probiotics and prebiotics role in the gastrointestinal infections. Now we'll see the constipation. Okay. So here a lot of observations are there related to the usage of bifidobacteria and lactobacilli in the patients who are suffering with the constipation. So these bacteria, they decrease the uh, constipation levels and increase the levels of bacteroids in the constipation patients. So here, these bacteria, they are provided as a symbiotic product, and these products, they are result in the production of short chain fatty acids. These particular short chain fatty acids, they regulate the motility by increasing the release of serotonin and stimulating the enteric or vagal nerves, acting on colonic smooth muscles. And not only probiotics, prebiotics are also used for constipation. One randomized controlled trial study, so they demonstrated that the consumption of 15 grams of chicory inulin daily for 28 days by elderly adults with constipation led to increased levels of bifidobacterium and an improvement in constipation and quality of life. Some gastrointestinal side effects like flatulence were noted with inulin supplementation, but did not lead to discontinuation in the study. And another study demonstrated that inulin consumption led to significantly increased stool frequency in constipated adults. In addition to inulin, they support stachyose granules, a mixture of alpha galacto-oligosaccharides. They also shown efficacy in the constipation. And a randomized control study. In that, they demonstrated that 5 gram per day of this DSGs for 14 days led to increased levels of fecal bifidobacteria and lactobacilli and decreased levels of fecal Clostridium perfringens in healthy patients. So furthermore, treatment with 5 grams of DSGs daily for 30 days in constipated patients improved the efficacy, ease, and frequency as well as softer tools, and no adverse effects were noted. And another prebiotic, that is the 11 grams of GOS, galacto-oligosaccharides, they increase the stool frequency in adults with less than 3 bowel movements per week in another randomized control trials. So the evidence suggests that prebiotics, especially GOS, are safe and effective in improving the constipation and may exert their effects by modulating the gut microbiome and bifidobacterium levels in particular. And probiotics for constipation. And here, if you observe the probiotics, bifidobacterium lactis, it increases the stool frequency in adults with chronic constipation. And another probiotic strain, that is Bacillus coagulans and lactic acid Bacillus casein shirota, a mixture of probiotics and Bacillus coagulans, they improve the abdominal pain and defecation pain. So overall, these probiotics, they improve the response to treatment and integrative symptom scores, but no species or strain-specific effects were identified for these metrics. And another study, they found that daily supplementation of Streptococcus thermophilus and Lactobacillus plantarum, they improve stool consistency in adults with constipation after 4 weeks of treatment. Interestingly, the relative evidence of Lactobacillus plantarum in the fecal microbiome in the probiotic group 4 weeks after discontinuation of the supplement, suggesting that it may confer a prolonged benefit. And here, if you observe, so this is the constipation, and after usage of these probiotics, the bowel movement will be there, and whatever the hardened stools become softer, and this particular epithelial layer activates the bowel movement, and the stool will be moved from colon cells to excretory system, and in this way, the constipation will be removed. The prebiotics, GOS and ZOX and FOS and oligofructose, they demonstrate to be helpful in encouraging the native bifidobacteria and lactobacilli. And apart from probiotics, prebiotics also modify the gut flora and lowers the pH of the gut, increasing the fecal bulk and creating an osmotic action that increases the water in the large bowel. All these leads to the improvement of the constipation, and the constipation will be removed. And duration of probiotic treatment and concomitant laxative may also impact its efficacy. And one liquid probiotic formulation containing the Bifidobacterium animalis, lactis, and Estophilus and KC, they increase the cumulative number of bowel movements after 10th week of treatment in patients without concomitant laxative usage. So all these results are promising that probiotics, especially multi-strain formulations, are safe and effective in alleviating the constipation. And more studies comparing probiotics to conventional fiber therapy are needed to demonstrate the superiority, given the additional consideration of cost, stability, and storage associated with probiotics. See here, the modulating the gut microbiota by beneficial bacteria improves the intestinal barrier function, bowel movement, and then relieve the constipation and increase defecation frequency. So like this, we can clear the constipation in the patients. Thank you all.